Hepatitis D infection, mode of transmission. Most common mode of transmission. This is slightly a uncommon virus. So they will ask you only the most common things, like most common mode of transmission in endemic areas and most common mode of transmission in non-endemic zones. Most common mode in the endemic areas is a close contact. Close contact. Close contact can be a percutaneous mode of transmission or the vertical mode of transmission. Non-endemic areas is a percutaneous mode of transmission. No one will ask you the percentages. Now the clinical features. Under the same heading, epidemiology, unique features and complications. Epidemiology. This hepatitis D virus has the maximum risk of converting into fulminant hepatitis. What does that mean? Though it is a rare, uncommon virus, but once it occur in any individual, it will cause more chances of fulminant hepatitis. So this is the virus which has a maximum risk of leading to fulminant hepatitis. Reason is in the unique feature. Why the risk is maximum? Reason is hepatitis D needs hepatitis B for its growth and replication. So actually body is infected by two viruses, and when there are two viruses in the body, in the liver, so liver damage is more. So always associated with hepatitis B. Complications. So complication is a fulminant hepatitis, that is the main important complication. Complication of carrier and chronic hepatitis depend on B status, but fulminant depend on how the hepatitis D is coming into the body. So the complication is most importantly is a fulminant hepatitis risk after acute viral hepatitis episode of D. This risk depend upon how hepatitis D is entering into the body. If both B and D are simultaneously coming, that is known as co-infection. So risk is 5% risk if co-infection. If there is a co-infection, 5% risk. While B was already there chronically, and on that D came super infection. So if super infection, the risk is 20%. Very high risk. Now, how the serology will behave? So to understand the serology, let's split co-infection and super infection into co-infection is equal to acute hepatitis D plus acute hepatitis B. That is the meaning of the co-infection. Both are coming acutely. Now translate one by one. Acute word we translate as IgM. Hepatitis D antibody, anti-HDV. Acute word IgM. Hepatitis B antibody, which can be detected as IgM, and IgG is anti-HBC. For superinfection will be acute hepatitis D plus chronic hepatitis B. Same thing, same fundamental we will use. Acute is IgM. Hepatitis D antibody, anti-HDV antibody. Chronic IgG. Hepatitis B antibody will be anti-HBC antibody. Like that we can differentiate easily. Now the treatment. It has to be treated because very high chance of fulminant hepatitis. So the treatment for hepatitis D virus is the antiviral, which will cover both B as well as D, which is effective against both the viruses. So the drug of choice here is interferon. Duration is variable duration, maybe it can be a 6 months duration or maybe 1 year duration. Now, so this was the case of hepatitis D.